Question 1. The root word nephr/o refers to which organ? A. Liver. B. Lung. C. Kidney. D. Nerve. Answer: C. Kidney. The correct answer is kidney, as this question tests your knowledge of organ-specific root words. The combining form nephr/o is used in medical terminology to refer to the kidney. For example, a nephrologist is a doctor who specializes in kidney diseases, and nephritis is inflammation of the kidney. To remember this, think of the nephrons, which are the tiny filtering units inside the kidneys. Question 2. The prefix dis means A. Good, normal. B. Bad, painful, difficult. C. Above, excessive. D. Within, inside. Answer: B. Bad, painful, difficult. The correct answer is bad, painful, or difficult, as this question tests your knowledge of common medical prefixes. The prefix dis indicates something is abnormal, painful, or difficult. For instance, dysphagia means difficulty swallowing, and dyspnea means difficult or labored breathing. Remember that dis points to dysfunction or difficulty in a medical process. Question 3. What is the correct plural form of the word diagnosis? A. Diagnoses. B. Diagnosi. C. Diagnoses. D. Diagnosa. Answer: C. Diagnoses. The correct answer is diagnoses, as this question tests the rules for forming plurals of medical terms, many of which derive from Greek or Latin. For words ending in is, the plural is typically formed by changing the is to es. Therefore, the plural of diagnosis is diagnoses. Just as crisis becomes crises, diagnosis follows the same pattern for its plural form. Question 4. Which term describes a position closer to the point of attachment or the trunk of the body? A. Distal. B. Proximal. C. Lateral. D. Medial. Answer: B. Proximal. The correct answer is proximal, as this question tests anatomical position terms. The keyword closer to the point of attachment is the definition of proximal. For example, the elbow is proximal to the wrist because it is closer to the shoulder, the point of attachment. A good way to remember is that proximal is in close proximity to the trunk of the body. Question 5. The combining form my/o refers to A. Bone marrow or spinal cord. B. Mind. C. Fungus. D. Muscle. Answer: D. Muscle. The correct answer is muscle, as this question tests your knowledge of musculoskeletal root words. The combining form my/o refers to muscle tissue. This is used in terms like myalgia, muscle pain, or myocardium, the muscular tissue of the heart. A simple way to remember is to connect my/o to the word muscle itself, as they both start with my. Question 6. The suffix pexy means A. Surgical fixation. B. To break. C. To bind or tie together. D. To view. Answer: A. Surgical fixation. The correct answer is surgical fixation, as this question is about identifying the meaning of a specific surgical suffix. The suffix pexy denotes a surgical procedure to fix in place or secure an organ that has prolapsed or is out of its normal position. For example, a nephropexy is a surgical procedure to fix a floating or mobile kidney. A simple way to remember is to think you need to fix something, and pexy sounds a bit like fixie. Question 7. The term ischemia refers to A. Death of tissue. B. A benign tumor. C. Excessive bleeding. D. Deficient supply of blood to a body part. Answer, D. Deficient supply of blood to a body part. The correct answer is a deficient supply of blood, as this question tests a common pathological condition. Ischemia is the medical term for an inadequate blood supply to an organ or part of the body, often due to a blockage in the arteries. For instance, myocardial ischemia is when the heart muscle doesn't get enough blood flow, which can cause chest pain, angina. A helpful way to remember is to break it down. Isch means to hold back, and emia relates to blood. Question 8. The term contralateral means A. On the same side of the body. B. On the opposite side of the body. C. Pertaining to the front. D. Pertaining to the back. Answer, B. On the opposite side of the body. The correct answer is on the opposite side of the body, as this question evaluates your knowledge of directional terms. The prefix contra means against or opposite, so contralateral means affecting or pertaining to the opposite side of the body. For example, a stroke in the left hemisphere of the brain may cause contralateral paralysis on the right side of the body. Remember, contra means opposite, while ipsi, as in ipsilateral, means same. Question 9. What procedure is indicated by the suffix tomy? A. Surgical puncture to remove fluid. B. Creation of a new opening. C. Incision or cutting into. D. Surgical fixation. Answer, C. Incision or cutting into. The correct answer is incision or cutting into, as this question evaluates your knowledge of suffixes related to surgical procedures. The suffix tomy means to make an incision or to cut into a part of the body. For example, a tracheotomy is an incision into the trachea, windpipe, and a gastrotomy is an incision into the stomach. To remember this, think of an anatomy class where you learn by dissecting or cutting into things. Question 10. The prefix brady means A. Fast. B. Slow. C. Without. D. Against. Answer, B. Slow. The correct answer is slow, as this question tests prefixes related to rate. The prefix brady means slow. For instance, bradycardia is an abnormally slow heart rate, while bradypnea is an abnormally slow breathing rate. Remember that tachy means fast. Thinking of brady as the break can help you recall that it means slow. Question 11. Which plane divides the body into anterior and posterior portions? A. Sagittal. B. Transverse. C. Coronal or frontal. D. Oblique. Answer, C. Coronal or frontal. The correct answer is the coronal plane, as this question tests anatomical planes of the body. The coronal plane, also known as the frontal plane, is the vertical plane that divides the body into front, anterior, and back, posterior, sections. Imagine wearing a crown or a tiara. The line it creates on your head represents the coronal plane. This visual can help you remember that the coronal plane separates the front from the back. Question 12. The suffix raphifi means A. Surgical crushing. B. Rupture. C. Suturing or stitching. D. Flow or discharge. Answer, C. Suturing or stitching. The correct answer is suturing or stitching, as this question focuses on a specific surgical suffix. The suffix raphifi means to suture or stitch a structure, typically to repair it. For example, herniorrhaphy is the surgical repair of a hernia by suturing the abdominal wall. A helpful tip is to associate raphifi with a rhapsody of stitches needed to complete a repair. Question 13. Which of the following combining forms pertains to the liver? A. Gastr/O. B. Col/O. C. Hepat/O. D. Enter/O. Answer, C. Hepat/O. The correct answer is hepat/O, as this question tests your knowledge of combining forms for digestive system organs. The correct combining form for the liver is hepat/O. This is seen in terms like hepatitis, inflammation of the liver, and hepatomegaly, enlargement of the liver. To remember this, think of the disease hepatitis, which is widely known to affect the liver. Question 14. What does the suffix plasty mean? A. Surgical removal. B. Surgical repair. C. Visual examination. D. Incision into. Answer: B. Surgical repair. The correct answer is surgical repair, as this question tests your knowledge of surgical suffixes. The suffix plasty means surgical repair or reconstruction of a body part. A common example is rhinoplasty, which is the surgical repair of the nose. An easy way to remember this is to connect plasty with the term plastic surgery, which involves repairing or reshaping parts of the body. Question 15. The prefix peri means A. Through. B. Around. C. Below. D. Many. Answer: B. Around. The correct answer is around, as this question is testing your knowledge of common prefixes. The prefix peri means around or surrounding. For instance, the pericardium is the sac that surrounds the heart, and periodontal disease affects the tissues around the teeth. A good way to remember this is to think of the word perimeter, which is the boundary around an area. Question 16. The term oste/O is a combining form that refers to A. Cartilage. B. Muscle. C. Bone. D. Joint. Answer: C. Bone. The correct answer is bone, as this question assesses your understanding of musculoskeletal root words. The combining form oste/O specifically refers to bone. A common example is osteoporosis, a condition where bones become weak and brittle, or an osteoma, which is a benign tumor of the bone. An easy tip is to connect oste/O with osteopath or osteoporosis, both common terms related to bone health. Question 17. The root word arthr/O refers to A. Artery. B. Joint. C. Fatty plaque. D. Cartilage. Answer: B. Joint. The correct answer is joint, as this question tests knowledge of common musculoskeletal root words. The combining form arthr/O means joint. This is a key component of words like arthritis, inflammation of a joint, and arthroscopy, a procedure to visually examine the inside of a joint. Remember the common condition arthritis to always link arthr/O with joints. Question 18. Which term means lying on the back? A. Prone. B. Supine. C. Dorsal. D. Ventral. Answer: B. Supine. The correct answer is supine, as this question assesses your understanding of anatomical positions. The term supine describes the position of lying on the back, face up. For example, a patient is placed in the supine position for many types of abdominal surgery. An easy way to remember this is that supine has the word up in it, reminding you that the person is lying face up. Question 19. A neoplasm is best described as A. An infection. B. A new and abnormal growth of tissue. C. A decrease in cell size. D. An increase in cell size. Answer: B. A new and abnormal growth of tissue. The correct answer is a new and abnormal growth, as this question assesses your understanding of pathology terminology. A neoplasm is an abnormal growth of cells, also known as a tumor, which can be either benign, non-cancerous, or malignant, cancerous. The term literally breaks down into neo, new, and plasm, formation or growth. Think of neo meaning new to remember that a neoplasm is a new, uncontrolled growth. Question 20. The prefix luke/o is used in medical terms to mean A. Red, B. Blue, C. White, D. Black. Answer: C. White. The correct answer is white, as this question tests prefixes that indicate color. The prefix luke/o means white. This is seen in the term leukocyte, which is a white blood cell, and leukemia, a type of cancer affecting white blood cells. To remember this, connect luke/o with leukocytes, the body's white defenders against infection. Question 21. What does the suffix ectomy signify? A. Creation of an artificial opening. B. Surgical removal or excision. C. Suturing or stitching. D. Viewing or observation. Answer: B. Surgical removal or excision. The correct answer is surgical removal, as this question tests knowledge of surgical suffixes. The suffix ectomy means the surgical removal or excision of a body part. For example, an appendectomy is the surgical removal of the appendix, and a tonsillectomy is the removal of the tonsils. Think of exit or excision when you see ectomy to remember it means taking something out. Question 22. The term superficial means A. Away from the body surface. B. Toward the body surface. C. Below another structure. D. Lying flat. Answer: B. Toward the body surface. The correct answer is toward the body surface, as this question assesses your knowledge of terms describing relative position. Superficial means located on or near the surface of the body. For instance, the skin is superficial to the muscles, and a superficial cut only affects the top layers of skin. A great way to remember this is to think of something superficial as being on the surface. Question 23. The suffix centesis refers to what type of procedure? A. Surgical removal. B. Visual examination. C. Surgical puncture to remove fluid. D. Crushing of a stone. Answer: C. Surgical puncture to remove fluid. The correct answer is a surgical puncture to remove fluid, as this question tests your understanding of suffixes for medical procedures. The suffix centesis means a surgical puncture, usually with a needle, to remove fluid from a body cavity. A common example is amniocentesis, where a needle is inserted into the amniotic sac to withdraw fluid for testing. Think of centesis as needing to find the center of a cavity to perform the puncture. Question 24. What does the prefix tachy mean in a medical context? A. Slow. B. Under. C. Fast. D. Between. Answer: C. Fast. The correct answer is fast, as this question tests your knowledge of prefixes related to rate or speed. The prefix tachy means fast or rapid. It is commonly seen in the term tachycardia, which describes an abnormally fast resting heart rate. A simple way to remember the difference is that tachy is the opposite of brady, slow. Think of a car's tachometer, which measures speed. Question 25. Which term describes the death of bone tissue due to a lack of blood supply? A. Osteomyelitis. B. Osteoporosis. C. Avascular necrosis. D. Osteosarcoma. Answer: C. Avascular necrosis. The correct answer is avascular necrosis, as this question assesses your ability to define a specific pathological condition of the bone. Avascular necrosis is the term for the death of bone tissue resulting from a loss of blood supply. Breaking down the term helps: A. Without, vascular, blood vessels, and necrosis, tissue death. Remember, avascular literally means without blood, which is the direct cause of the tissue death.